the next person is John Murphy, and John has joined us and is down for two posters. So I don't know how you want to work this, John. I don't know if you have them on your computer to hand.
Yeah, I have them here.
Well, leave. You should be able to share your screen, and I'll leave it to you to decide.
Grant, they're actually both around the same study, so I'll probably just use one of them to kind of focus the whole thing.
Whichever you pick, John. So whichever you prefer.
This was intervention we conducted pre-COVID. It was kind of a follow-on. We did a national questionnaire. You can see just the introduction here, the elevated symptoms of depression, anxiety reported 40% of adolescents. So it was a follow-on from that. We want to conduct an intervention because there's like some evidence that being more active is better for reduced anxiety and depression and increased well-being. But how much activity, type of activity, all like that is at yet unclear. So we kind of want to figure out, well, how much is impacting it or what types of activity. So it's in a sense exploratory. So we conducted it in a school, as I said, pre-COVID. We wanted to make it as informed by theory, particularly self-determination theory, because we found that the autonomy was a big part of the psychological benefits associated with activity. So allowed the participants themselves to self-select to groups beforehand. Conducted a questionnaire with them first around what activities they would prefer to do themselves. So, and left that largely open. So they had 3 options each, and just the most popular ones then were put on at various lunchtimes, conducted in the school. So they self-selected then to 1, 2, 3, or didn't go at all. We tested them for anxiety, depression, well-being, and self-efficacy at the start, and did the same around a few physical fitness measures. So cardiorespiratory endurance, muscular strength, muscular endurance, BMI at the start. Also looked at associations there and found no associations with any physical fitness measure and any of the psychosocial outcomes, which wasn't massively surprising, but also was interesting to note as well. The only slight association was a slight inverse association with BMI, but nothing at all with anything else. There was no like pattern noticeable anywhere. After doing it then, it was 10 weeks long. So when we retested then at the end, we found, I might be able to zoom in a little bit on some of these. Did that zoom?
Mm-hmm.
Yeah, that's right. So I found, so these are the 4 groups. So group 1 are 0 times a week, once a week, twice a week, and 3 times a week. So those who went 0 times a week had increases in symptoms of anxiety and depression. Those who went once a week in anxiety had no change. In depression had a small but not significant decrease. You can see the blue compared to the red there. Those who went twice and 3 times a week both had significant decreases in symptoms of anxiety and depression. So it suggests there that going or being active 2 to 3 times a week or more had an impact on symptoms of anxiety and depression. It wasn't quite the same for well-being, because like throughout all this we've seen that well-being isn't just a lack of anxiety and depression. They're somewhat related, but they're still separate constructs in their own right. So there we found that the significant increases in well-being were in those who went 2 and 3 times a week. It wasn't enough to just go once, but there wasn't a significant decrease in those who didn't go either. What was most interesting was that the changes in self-efficacy were very similar to the changes in well-being, down to like effect size as well. So for me, the big suggestion there is that the increased well-being could well be coming from an increase in self-efficacy through being active. Because it was largely a games-based intervention, that there was an element of, it's something, if I was to do again, I definitely put something around how to measure an improvement or perceived improvement at it. But there was room for improvement at what it is you were doing. So I'm wondering, was it the being active, or was it the improving at something that led to the increase in self-efficacy that had a knock-on impact to well-being? I think going forward, that's kind of, isolating those a little bit better to see what's actually leading to knock on the next one is probably the thing that needs to be looked at next. And you just see the various results and everything there. Yeah, that was the big conclusion, that the higher frequency of activity led to increased mental health, but its self-efficacy may be an underlying mechanism for the increases in well-being. There's a full paper on it. It's in review at the minute. So if you want to scan the QR code there, you can get access to that to find out a little bit more about it. And just see the general timeline of it here then as well. Yeah, that's generally it.